have medical insurance or don't have insurance that will pay for mental health therapy. And we definitely need to normalize going to a therapist, going to a psychiatrist, getting put on some medication for depression and anxiety, and buying into that system. Number 8 is knowing someone close who used suicide as a way out. Big one, right? Especially if it's a parent. You have a higher risk of committing suicide yourself if your parent did that as well. Number 9 is significant dates, such as a anniversary of a loved one's death or of their birth. Sometimes that's really hard for people, especially if it's been a parent or a guardian or somebody very close to them, can make you at a higher risk for suicide. Divorce, bullying, sexual preference discrimination, discrimination in general, poverty and sexual abuse, past or present, PTSD, CPTSD, all those things are risk factors. Now, these are just risk factors. It doesn't mean that if you have these things or have gone through any of these things that you're going to commit suicide or that somebody needs to watch you like a hawk. No, it's stuff that, a person that loves you or is near you a lot can watch for these warning signs. And if these warning signs are adding up, 1, 2, 3 things, then, you might be at a higher risk of committing suicide. If someone is talking about suicide, please sit and listen if they will allow you to. Encourage them to call 988 or 911. Encourage them to call their therapist if they have one. Encourage them to go to a mental health facility and get emergency services. You can walk into any hospital at any time and get services for mental health. A lot of places around Vermont are cutting their amount of beds that they have for psychiatric patients, and I hate that because this is an epidemic that needs to be talked about and thought of, and needs to, people need to know that there are services when they are in crisis. Vermont is trying to reduce the stigma around talking about mental health. So let's normalize therapy, right? Vermont